So we have to focus here on, or our management has to focus on definitely what is to be done for relieving the most distressing symptoms. How can pain be managed? How to make the patient cope up with the condition? And very important factor, how the patient can have a better quality of life and whether we can enhance the survival time. So that is our focus on those category of the patients who come under the incurable terminal chronic illnesses which form the spectrum of palliative group. These are the focuses that a physician should have. And the objective of the palliative care does not include only the individual, but we also have to encompass the family and the near and dear ones. And it starts right from the diagnosis through the disease progression till death and extends to bereavement. That means a role of a palliative physician does not stop with the death of the person, but our care has to go beyond that. Coming to the history, we have come to this new, very modern evolution of the palliative care right from the beginning of 1900s, where Dame Cicely Saunders formed the concept that when you don't have a clear-cut definition of how to bring health back to normal, then what can be done for a dying patient, or what can be done for a patient who is evolving in his disease state. So what started as a hospice movement in England later resonated into the palliative category of care, which is, maybe if we look into the old times, even during the times of Ashoka, the emperor, there were palliative hubs where sick people were catered, where people who were not being able to be cared at homes were brought to destitute homes, where there was a facility for care to be given, where it was not just medicinal management but also care and compassion and love. So that is the whole concept of palliative care, where NGOs in different parts of India took it up as a great movement. So that is why India stands maybe it is even represented in WHO very well, that palliative policy was drafted well in India. And Kerala was one of the first states to implement the policy as a policy in 2008. So that is how we, the government institutions in Kerala, had to follow the palliative policy, where it became implemented in Ayush in 2016-17. So this is the WHO definition of palliative care. Here we can see that it is about improving the quality of life of patients and individuals and families who are facing challenges associated with life-threatening illness, where, as we see here, that the philosophy of homeopathy is very well recognized in palliative care, where we look into not only the physical problems of the patient, but takes also into account the psychosocial, social, and spiritual components. As we have heard from the first speaker, when we are faced with a condition where we know our health is not going to come back, the first questions that come to the mind of a person is, why I am suffering? Why me? I have done everything right until now, but why I am destined to suffer? Whether it was something which I've done before, whether somebody has a curse on me, or whether I have to do something to pacify some hurt people. So all these things also, the suffering, the agonies, the anxieties, isolation, everything has to be supported for. And that is where the philosophy of homeopathy is closely aligned with the concept of palliative care. So the goal of palliative care is therefore to improve the quality of life of the patient and the family by taking into account and responding to pain, distressing symptoms, to provide nursing care and psychosocial and spiritual support. So it is always an interdisciplinary and multidisciplinary approach, and definitely the care becomes more defined when there are a team associated with it. The team comprises of doctors, nurses, counselors, social workers, volunteers, and even single individuals who have a kindness in the heart, who can be there for any other suffering person. So statistically speaking, we know that only 2% of the people who really suffer from this type of disease fall under the purview of palliative care. So we have to focus on 98% of the other patients in India. And globally, only 14% receive really the palliative care services. So unlike the concept that we thought palliative care was only given to cancer patients, we know now that the bulk of the patients who come under palliative care are non-cancer patients from cardiovascular disease, respiratory, HIV, diabetes and complications, then also neurological conditions and congenital anomalies. So all the time, and now autoimmune diseases are coming up. So all these spectra of conditions come under the purview of palliative care. So one thing we have to always remember is that palliative care is not best when it is offered at the end, but very early in the course of the disease. And the basic focus is to improve even the economical viability, because it will prevent unnecessary hospitalizations and use of other healthcare services. So the economic component is very important when homeopathy is integrated into the palliative care. So we have to take care of the issues beyond the physical symptoms, and it is also an approach to support even the caregivers, because the life of a family changes when somebody in the family, one member is diagnosed with a condition which is progressing, and the practical needs have to be addressed. So actually palliative care is on practical words, we say it can be a support system to help the patients live as actively as possible until death. And now coming into the possibilities of homeopathy, where do we stand in this palliative care domain? Definitely the holistic perspective, that is the most important thing. Even in a simple case taking of homeopathy, we take care to address not only the physical symptoms but the emotional and the mental picture as well. So in our domain, every case can be understood in this perspective, and we can focus on the symptom definitely, and also we have to address those category of patients who have been optimized on conventional treatment like morphine. Morphine is optimized, but still they are having pain, still they are having suffering. Is there no way out? So those are also the category of patients who depend on homeopathy. The emotional and spiritual support given during the case taking, which makes the patient bonded to the physician, is also one possibility of homeopathy. The quality of life improvement, which we see in every clinical case. The economical viability in the long-term care. And also the care can be shifted from a hospital setting to a home care setting when we have a homeopathic integration. Definitely the end of life care. It is a very important focus where homeopathy can have its own advantages. And also the benefit is that homeopathy can integrate with other therapeutic modalities. We need not stop any other treatments just for starting homeopathy. So out of our cases which have come to our center, when we categorize the type of patients who come for palliative care, those are the cases where conventional medicines were optimized, but we see that the cases are relapsing and progressing, or we have certain cases where the patients have inoperable tumors. Sometimes it is the inoperable sites, sometimes it is the age of the patient, and otherwise the general condition of the patient which prevents a surgery. And the two category of patients, one belonging to the pediatric age group, the other belonging to the geriatric age group. And we also have cases which have drug reactions and allergies, and the cancer cases where chemoradiation is deferred, and a category of patients belonging to neurological cases with disabilities, and the children who are born with genetic congenital disorders, and also the patients who are coming after post chemo radiation. They come to a center, they get admitted to the IP, They say that when homeopathic medicine was given, now they are having a better, the symptoms are getting better quickly than when homeopathy was not given. So those are the category of patients who primarily we have to focus on. Now, what can be the benefits? Definitely, we see that there is pain relief, symptomatic relief, quality of life improvement, lesser hospitalizations, fewer antibiotic use, and fewer conventional medicine dependence. Also, we can manage the intervening infections with our medicines. So, in now coming to perhaps cancer cases, we have to address, there's a possibility to address symptomatically, like focusing on the pain, nausea, anxiety, fatigue, breathlessness, insomnia, constipation, etc. Sometimes we find that it is these symptoms which are unrelated to cancer which are more distressing to the patient. Sometimes it can be a constipation which is causing more suffering to a lung cancer patient. So there's certain other examples where we can focus on the symptoms are maybe in oral cancer, we have ulcerations, pain, dysphagia, etc. So as we can see that CCRH has taken up many research works and projects and intervention studies where mucositis is addressed, how homeopathically can improve the quality of life. So likewise, if we focus on each type of cancers, there are certain particular symptoms which can be better managed with homeopathy when homeopathy is given as an add-on. Now I would like to focus on how the palliative project is conducted in our department. So it first started in the year 2016-17 when the government of Kerala drafted a palliative policy in 2008. It mandated that all the Ayush institutions have to be brought under the palliative policy. So that is where in our department, first we started the secondary care activity where there was a special OP for palliative care in all the district hospitals, and there was an inpatient department. And the basic core of palliative project was domiciliary service or home care, where a team comprising of the palliative doctor and the palliative nurse would go to the houses where we could see the homebound and the bedbound patients. So that is how our working model is categorized. Like now we have the palliative special OP in all the district hospitals around the state, which is 34 institutions. And every departmental doctor, we have more than 1,000 doctors of the dispensaries plus National Ayush and National National Rural Health doctors. So all of them participate at least once a month by providing home care to the patients. So they visit the patients with the community nurse who are appointed by the local self-governance. So the aim and objective of the project is to address the pain most distressing symptom, to improve the quality of life of the patient, how we can incorporate homeopathy in palliative care, and also underlining the concept of holistic care, how we can support the end-of-life care, and ensuring that all the patients get free service, and also whether a cost-effective long-term management can be implemented. And the major thing is sensitizing the public about the scope. So now we are even sensitizing the ASHAs of how they can identify the cases which can be recommended or brought to a government homeo dispensary. So this is how the working model is. We have a palliative team where there is a resident medical officer in each hospital, district hospitals and the other taluk hospitals. So the RMOs are primarily managing these cases, supported by the doctors from National Ayush Mission and the other supporting team. Then we have a palliative nurse, we have also supporting staff, and also we take into account the other staffs from the yoga or psychologists who are associated with the other projects. The home visits are delivered according to the needs of the patient. It can be daily or weekly or monthly depending on how the patient is. And also we focus not only in giving medicinal support but also pure supportive care. Sometimes the patient do not need medicine, so we sometimes provide only oral care, skin care or catheter change or enteral feeding or how we can minimize these dependence and by supporting the caregiver as well as the patient. And that is how the home visits are planned. So the operational methodology, as you can see, it is once a week OPD, home care team, there is an inpatient care service, and the primary palliative work in all the dispensaries at least once a month with integrating the other doctors. So sometimes they go as a team, sometimes the doctors from the ISM department and the modern medicines go together with the homeopathic doctor, or they go separately. They could see a patient who are taking the other systems of medicine also. And those cases which cannot be limited to this primary level are referred to the secondary centers in the district hospital. So it is the free of cost treatment, and also we give counseling, physiotherapy and yoga services. There is distribution of accessories like a wheelchair or a walker or whatever that the patient needs, and also throughout supporting the nursing care. So the socio-economic impact is very deep because we have made a statewide presence in this palliative activities of the state. Now we are working with the palliative project of the department, other departments as well as the state policy also. And we visit institutions where old age homes are there, destitutional homes are there, and we also work hand in hand with the social service department, police department, who identify the cases and send to us. Sometimes in rehabilitative work, we are supported by the social service departments. So we have seen a steady increase in the patients' inputs right from 2017 when this project first started. All the doctors of the National Ayush Mission, National Health Mission now participate in this palliative project. And there is definitely an increase in the awareness of among the general public about the role of homeopathy in this palliative care. The economical benefit is very, very important. Long term, the benefit is even more. Even it is when considering from the government policy, those patients who come to homeopathy, the bulk of the patients, the cost effectiveness can be minimized or reduced from the conventional stream as well. So we team up with the accredited social health activists, community nurse, volunteers, field staff, NGOs. So now we are sensitizing even the student community, the college students and the school students, and they are trained to participate with the home care because the presence matters a lot to the patient who is at home. A quick look into the annual state data, we can see that the care is distributed as in the OPIP and home care and institutional visits. There is a steady increase in the data. Currently this year we have seen more than 1 lakh patients through all our institutions. So there is more type of non-cancer cases than cancer cases. In some centers it is 50-50. So that is where the homeopathy has also a reachability in this particular field. So now coming into the evidences and researchers, I would like to take now your attention to the few type of cases that we see. Some cases are purely dependent on homeopathy, some cases we give homeopathy as an add-on. So how we can improve the quality of life, that in any given case, that is the take-home message I would like to convey. So this is a case of metastatic adenocarcinoma lung with bone and spine meds. As you can see, that lady's legs are amputated. So previously it was a very difficult scenario where she has to be lifted with the chair and taken, like she was staying in a very narrow, in a hill where the road was very narrow. So to reach the car, even the neighbors had to be there, present there, and she could be moved only in a trolley or in a chair. But after our team went and saw her, the care was moved only to a home. She was never again shifted to a hospital. There was no respiratory infections. All the respiratory infections were primarily managed with our medicine. Then she never had any recurrence and she had a peaceful death at home. The next is a case of myoclonic seizures. As you can see, this is a 30-year-old male who had frequent seizures, 30 to 40 seizures a day when the team first came to visit the patient. It was diagnosed as a static encephalopathy case, perinatal. And here also, as you can see, the man is more than 100 kilos. He is lying on the floor because of the frequent seizures and the injuries that happened to him. He can't be put on the bed. And here again, like the first case, it was very difficult for the patient to be shifted every time to the hospital. So with our homeopathic intervention, the outcome was the seizure attacks could be reduced. It was just 5 to 10, less than 10 a day. And correspondingly, the conventional medicines could be tapered. So the whole health became better. There was more awareness, reduced rates of respiratory infections, and no hospitalization after homeopathic treatment. So that is what the patient says they are benefiting more, and that is giving them more economical freedom and more peace. So this is a case of CA ovary with metastasis. As you can see, you can see one mets there in the umbilical area. So here it was first a homebound patient, but now the patient symptomatically improving. She is now coming to the OP, and after we did a review after the year, there was no disease progression. Still now she is continuing the treatment. So this was a case of acute lymphoblastic leukemia, a rare type where we got the baby as a 4-month-old, and from the conventional cancer center, the treatment was deferred because the baby was having pneumonia and UTIs. But after our medicine was started, no blood transfusions was required, and we could first control the infections with homeopathic medicines, and after that the infection rate was minimized, and then we could save the child for another 6 months. So this was a beautiful case, a case of non-healing venous ulcer where the patient was already under treatment for 17 years with no improvement. We picked up 48 maggots from that ulcer. We put the patient, we admitted her in our IP, and we started managing the ulcer with our homeopathic medicine. Crataegus was given along with the sulfur was selected as a constitutional remedy. Then sulfur was given internally, Crataegus externally, and you can see that the ulcer is healed within 3 months. The patient is still coming to us just to see us, not as a patient. And so that is how we could improve the quality of life in her. This was a case of amyotrophic lateral sclerosis. Actually, the patient was completely bedridden, nasogastric tube. We couldn't take the first picture because it was a very depressive scene at the house. The wife is a nurse who had to quit the job just to care for this person who was working in Gulf, who was sent here once he was diagnosed. So then within 2 weeks, we started seeing the improvement. Causticum in 0 LM potency. So the improvement was started within 2 weeks itself. And here, this is how we saw the patient in the first follow-up after 2 weeks. The patient now has resumed his work. He's now taking tutoring children at home. So now he moves in a wheelchair and still continues treatment. This was a 1.5-year-old male child who was referred to us with neuroblastoma with liver metastasis. Here again, he was taking the treatment from a conventional cancer center, but the 8 chemotherapies could not reduce the size. Also, the treatment was deferred because the child was too ill to endure it. And first, we started the constitutional treatment medorinum, and the frequent infections was managed with admission into our IPD. We gave different acute spell, pulsatile response accordingly, and we started seeing the improvement with the first year of assessment. The size of the neuroblastoma was reduced from 3.7 to 2.4 to 6 centimeters to 4 into 2.2 to 1.6. And the third year onwards, there was no mets in the liver. Correspondingly to the reduction in the primary focus, we could see that the metastatic focus was also reducing. And so now in 2024 and 25, there is no lesion, no primary and no metastasis. And the child is now has gone back to the school, is now actually the class topper and enjoys the life as a regular student. This was again a case of retroclival meningioma, inoperable stage with perinephric adenoma. He was brought to us during COVID times. The patient was in an inoperable state of health. So he was he was deferred until his health improved. So here we started him on Silesia, in potency. So within the first follow-up in 3 weeks itself, you can see how much better the patient looks. He still religiously attends our OPD every 2 weeks. He was a tailor. He now goes back to his tailoring, and now he's also doing little other small works. And his daughter has finished her PhD, is married off. So taking the words of the patient, he says, homeopathy has given me the confidence to live and to have a future when all the doors were closed. When the surgeon said, we couldn't operate on you at this stage. So that was another case. Now, here, this is again a home care child who was again referred to us because she was operated, it was a craniopharyngioma, excised case with hydrocephalus, stage 2 heavy paralysis. So this was how we saw the child when we first saw her at home. And it was very difficult to get the case. Also, then we interviewed the father and the mother. We spent at least 3 hours, and then first visit we couldn't reach into a conclusion, so we went there next day. And then we started on carcinosin. So here, this is the response we see after 1 month. In here, we see that the child is sitting up, but still now, even though the child started talking, could not recognize the parents, but later on we can see that subsequent visits, the memory comes back, the child singing and walking and learning new things. So this child also is still continuing our home care, and our project grew along with she. And currently, she just wrote her SSLC exams, board exams, and she passed the exams. So we have every stage of her. I think the audio is not working, otherwise you could hear the sound. If the sound effect was there, we could have heard him crying like 24 hours. He's crying, amme, 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 like that. And it was actually the neighbors who brought the case to us because they couldn't endure it. So, and our team, I went to see the patient with the nurse, and it was a very heartbreaking situation there. So then again, the family was very depressed and first not very cooperative. So we came back and we looked into the boric, and then we went back and gave the remedy called strychnine. So after one day when we went there, we could see that the crying was not there anymore. The patient was lying peacefully. So actually that made a change in the wife, who opened up, and then we had a proper case taking session. And we started the patient on the remedy phosphorus, LM potency. This is what we see after a week. And after 1 year, you could see the remarkable improvement. Here you can see how the patient is confident, the confidence that you can see on his face. So here, this patient also, he was actually an engineer, again working in the Middle East. That whole life of the family changed when they had to take care of him for years. They sold everything. So now this is, I think, this one video where he turns around the confidence that he has conquered his situation. That is what I think is the whole message. So now this is another case of CA prostrate with skeletal lung lymph node mets. Here we can see the patient is 78-year-old. He has, in addition to the metastatic stage, he has Parkinsonism, hypertension, diabetes. So what can be done to this age, this stage? So we took up the case and we started him on cornea maculatum, LM potency again. So here beautifully within the first follow-up after 3 weeks, the patient's pain was reduced so much, he started walking around the house, outside. And subsequently, here we can see the PSA values. It was 875. It reduced to 2.48. See, and it stayed again 2.21. So here, this is one case where we can see it's not only symptomatically addressing, but here we can, even homeopathic medicines are going into the work of anti-cancer activity as well. So this is how the patient, so what else we can give to a 78-year-old having multiple metastases? He enjoys a good life with his plants, agricultural area, at home, no pain, with the spinal meds. If he is able to walk like this is what can be best delivered to a palliative patient. So again, another type of cases that we focus on are the muscular dystrophy cases. Here again, we can see that the children, their muscle strength is getting improved, the reduction in the falls, and they are able to manage things by themselves. They are now going to regular schools. Here we can see that this was one change which the child had. And now the child is enjoying a regular school life, now going to the neighborhood waterfalls, he's having a life as a regular child, not in the wheelchair, not at home. So again, this was another muscular dystrophy case. Both the siblings were diagnosed. The father deserted them because after the counseling, the father had the knowledge that this was transferred from the maternal side. So the mother was a maid who was working at home, but she couldn't leave the 2 children who were crawling at home. But our medicines made the children better. She started going back for work. The children started going to the regular schools. And they are still in our care. So this is again a stroke patient. And after we started adding, this was a homeopathic add-on. We started with Arnica, LM1, and we can see that how much within 1 year the patient is improved. It was taking many minutes for the patient to struggle to lift herself up, to sit in the nearby chair. But after this was on January, the same year in December, we can see the patient confidently managing things at home. It will take almost half a minute for her to come to the next chair. So here is where we focus, and the conventional medicines were tapered. So the quality of life improvement, that we are clinically seeing that. Now the patient goes outside to buy things and manages her grandchildren. So how much? We have to think from the patient's perspective. How much suffering it is for them if they cannot do a simple thing like moving from one place to another, or they have to depend, they have to call somebody for their own needs. So this is a cerebral palsy case. I'm coming to my last few cases. The cerebral palsy case here, the child was frequently in hospital, like 20 days she was hospitalized, her mother and father couldn't go home. So with our medicines as an add-on, her general health improved, she started becoming more interactive, more pleasant. She also, with the help of a scribe, she wrote the SSLC examination, she passed the exam. So the super confidence that she has, the happiness that she has, in spite of her the scoliosis and the other problems and the cerebral palsy, the best that we could give is now enjoyed by her. This was a 7-year-old boy with global developmental delay. Our medicines made him better physically, and also he started eating more, communicating more. Now he goes to a regular school. Okay, this was a case of HLA-B27 ankylosing spondylitis. It was a homebound patient where because of the stiffness he couldn't come to any hospital because he couldn't sit in a car or an auto. But after 3 months, he started visiting our OPD, and after 6 months, he started riding a bike. So now he goes for a regular work in his bike, and he comes with a small girl. So this is what is. This is a case of mental retardation with CA breast. This lady is 39-year-old, diagnosed with breast cancer. But from the regional cancer center, the oncologist said, we cannot do anything. We cannot administer anesthesia. And so she was referred to the palliative setting, and she was brought back home to our care because she lost her father in an accident. Her brother was a drug addict, and she was only supported by the mother. You can think of a situation where there is only a mother who cannot move out of the house, but our team visits them every 2 weeks. Now, all these 7 years, we have supported her. There is no ulceration, there is no pain, and she is normally living a comfortable life inside the house. So that is what. Now with all these cases, these are the different types of cases. So what I would like to convey is that homeopathy can definitely improve the quality of life in a very gentle way. Now taking this into the research evidences, we have numerous researchers coming up with different anti-cancer potential, or even how Parkinson can be improved, how our medicines are working on the neuronal cells. So all these researchers are going on where there, and there is still scope of multicentric studies by seeing how the quality of life can be improved pre and post add-on with homeopathic treatment. So the outcome in palliative care, now coming to the conclusion, with minimum drugs, improved quality of life, physiological functions can be improved, it can be added on to conventional systems, then we can even reduce the side effects and taper the drug load of the conventional medicines. The general vitality can be improved, effective pain management as we see in the cancer cases and the neurological cases. So homeopathy as a message, what it is taking to the patient, it is hope. We are giving them hope that is still they can have a hope in whatever condition they are in. So the scope of homeopathic intervention is that the therapeutic intervention can be effectively incorporated in palliative care services with least economic burden and least therapeutic burden. And effective symptom control and pain management is observed when individualized homeopathic medicines can be found out, but otherwise also, if that is not a very optimum case, then we can give based even pathological symptoms. So the quality of life improvement is noticed, cost-effective long-term treatment is the underlying point. So perspectives might differ with different medicinal systems, but our rationale is how we can integrate with a beautiful interdisciplinary approach of all the medicinal systems. So with this approach, we can definitely add life in your ears, even if you are in a palliative state. So with that, I conclude. Thank you for your patience.